Welcome back to the Morning Blend. Studies suggest that 40% of ankle sprains are misdiagnosed or poorly treated, and that can lead to chronic ankle pain and disability.
So how do you make sure your ankle issue is treated properly? Well, Tim Henke is back from Advanced Foot and Ankle of Wisconsin to discuss the types of injuries that could happen while you're enjoying that warm weather. So when we get out, we haven't been as active for a little while. Good to see you again.
Good to see you too.
See you.
All right.
Yeah, I mean, people want to get outside, so they're walking
Biking
more,
immediately.
running, biking, doing yard work eventually, and then things, it's very common, right, to have problems with your ankle?
Yep, absolutely. Ankle sprains are one of the most common injuries, and especially now that it's warmer out, people are getting out, doing more sports, more activities. It's a really common time of year for that to happen, especially since they've been sedentary during that long winter stuck inside.
And how do you know the difference? Because I always wonder about this because I have chronic problems like Tiffany just mentioned. How do you know the difference between, oh, it's swollen, I need to kind of give it a little rest or a little this or that, or when you need to see a doctor?
Absolutely. So one of the things that you look for is after you've had an injury, one of the big indicators is can you put weight on it? It's not the only indicator, but a lot of times if you're able to walk on it, that usually means it's not as serious. If you're not able to put weight on it, you need to get in to see a doctor right away because that means that something could be broken in there. So
a lot of people, you know, will wait though. They'll say, I'll wait it out a couple days. How many days, if you have recurring pain after 2 days, 1 day, a week?
Sure. So usually with a typical ankle sprain, you know, it's usually within a couple of days. There's something called RICE therapy, which it's an acronym and it stands for rest, ice, compression, elevation. First 24 to 48 hours, that's an important thing to do. Stay off of it, take it easy.
Go through that acronym one more time.
So it is rest, which means staying off of the foot. Ice, which means, you know, putting ice on it either behind the knee or on the area of the injury. Compression, which means an ACE wrap, a compression sock, something tighter around there to keep the swelling down. And then elevation, which can also help keep the swelling down.
How long should you ice your ankle if you're having a problem with it?
So icing typically 15 or 20 minutes on and then 15 or 20 minutes off. So you don't want to just put ice on your leg and leave it there for hours at a time.
Okay. And you kind of keep going on and off?
Yep, you absolutely can. And it's usually that first day or two when it's really going to be the most beneficial. And the more that you stay off of that and the more that you ice it, usually the less swelling you have. And the less swelling that you have usually means a quicker recovery.
All right. So, okay, what is one of the main problems is a lateral ankle sprain.
Sure.
What is that?
Yep, so I brought a foot model here with me to kind of give an idea of it. Basically what a lateral ankle sprain is, there are ligaments. There are several ligaments that attach to the fibula, which is the ankle bone, down to the foot. And there's one ligament in particular that runs from that fibula to the front of the foot here called the ATFL. And what that ligament does is it helps stabilize the foot. So when people sprain their ankle, that ankle actually rolls outward like this. The foot rolls inward and that ligament gets either stretched or torn.
Gotcha.
And so that's what a lateral ankle sprain is. Now the thing about that is that it's not just that ligament that can get injured. In really bad sprains, the ligament can actually tear off the bone. There are tendons that run here that can get injured or get tears in them, and then even the cartilage in the joint can get damaged. So that's why, again, if you've had a bad ankle sprain, it's important to get in and be evaluated. Sometimes we need to take x-rays, sometimes we get imaging like a CT or an MRI to actually look at the joint and the tendons there.
And is there something that's a problem specific to like a chronic sprain?
Yep, absolutely. So if you think of that ligament, what that ligament's job is it's to help hold the bones together. And if you think of it like a rubber band, that rubber band gets stretched out with time. So once you've had a bad injury, especially without proper rehab, and if you're prone to getting those injuries, it rolls again and again and again and gets stretched out, and you lose that position sense in the ankle. And so that's what a chronic sprain is. It's losing that position sense, and people typically will say on uneven ground or stepping off curbs, they're very prone to rolling that ankle.
Can you stretch? Will that help prevent an injury if you're going out for a walk or a jog or a run or just to work in the garden? Sometimes it's when you're not trying to do anything overly physical that you injure it.
Sure, absolutely. Yep, it's important to stretch and to warm up before activities. Anything that's going to put a lot of strain, side-to-side motion, tennis, sports like that, it's good to wear proper shoes. Hiking too, especially if you're walking on uneven ground. Shoes with higher counters that go up higher, give you some stability, are important to use. And then the other thing that can be important for people is a good pair of orthotics to help give them some stability and some support too.
So here's what I'm wondering about your evaluation, your diagnosis, then treatment in terms of a prognosis. Is you probably, it seems like you approach it from a couple different angles. I mean, if we're talking about orthotics, that's something very different than, say, physical therapy or
Sure.
surgery or something like that. So there are lots of probably different options to treat different ankle problems depending on how serious it is, how chronic it is.
Yep,
right?
Absolutely, and that's why it's important to be evaluated, because what we can do is there's two sides to that coin. There's prevention, and then there's actual treatment. And so if somebody comes in and they complain of rolling that ankle every month for the last couple of years, we have to look at it and see, sometimes we can do physical therapy to restore that position sense and that motion. Sometimes we actually have to do surgery to help tighten that ligament up and restore that function in that ankle. So there's a lot of different treatments, and there are a lot of different options for different patients. So that's, at Advanced Foot and Ankle, that's our job, to help talk to the patient and figure out what the best treatment plan is.
All right. Well, here's some information so people can come see you if they've got some issues, especially if you're having that recurring issue, or right now you've just sort of let it go. There's 4 locations for Advanced Foot and Ankle, or footanklewi.com is the website. The phone number on your screen as well to call for an appointment is 262-763-9007. That's how you can reach Dr. Tim Henke. Thanks for being here.
Thanks for having me.
Great to see you. Thank you.